It was a day that changed his life forever. A hit-and-run accident left 15-year-old Ferdinand Kierie fighting for his survival. But through occupational therapy, his journey to recovery is a story of resilience.
A little bit, step, yes, step a little bit. Just slowly, and do side again, that side again, that side again, that side again. Step back, step back, step back, step back. Very good. Can you move yourself now?
Occupational therapy, often shortened to OT, is a form of therapy that helps individuals achieve independence in their day-to-day activities after illness, injury, or disability. It is for anyone whose life has been disrupted, be it from a road traffic accident, a stroke, cerebral palsy, arthritis, or even mental health challenges. It isn't about occupation as a job, rather about your daily occupations like bathing, grooming, cooking, schoolwork, and even playing. With the unwavering support of his parents, Ferdinand is slowly rebuilding his life through occupational therapy at the Kenyatta National Hospital.
Huyu mtoto alipatwa accident akienda shule, ilikuwa 6:30. Ikakuwa ni hit and run kutoka 17th October last year. Tumekuwa na yeye kwa muda huo wote tukimfanyisha therapy. Alikuwa na mambo mengi yenyewe, lakini kwa venye tumeendelea kwa hii hospitali ya Kenyatta, tukaongeleshwa tukuje after ametoka ward na ICU, tukakuja huku kwa occupation therapy na tumeona venye tumeendelea vizuri.
Just a few months ago, he was fighting for his life here at the Kenyatta National Hospital. His path to recovery has been long, but with every day, he is one step closer to regaining his future. Dr. Eric Momanyi, a speech and language therapist, has helped Ferdinand recover his speech back.
When the boy came to our facility, he was not able to use or to coordinate his eyes and the hands because of he got affected from the accident. And as we've been doing the therapy, he's able to get the colors done. Fedi?
Yes.
He's trying to coordinate his eyes as well as his hand to color the activity. Also this one, you know, he was a boy in school. And in so doing, he's able to coordinate school vis-a-vis hospital. When he came to the hospital, 1 year off, he was not able to coordinate. Now, I'm trying to bring back that self-esteem that he can be able to write, and as he goes back home, he's able to redo whatever he was doing, that is schooling. Here he is. Now he's able to color. And I'm confident that he's going to achieve his goals in school. As an occupational therapist, I'm here to give that.
Through the therapy, Dr. Eric has also helped Ferdinand coordinate his movements.
You remember our game?
Yes.
Concentration is the game.
Keep ready if you can.
Fedi, Fedi.
Eric.
Fedi, Fedi.
Eric.
Now, I want us to mention this thing together, okay?
Okay.
Now, how I move. Can you repeat that with me?
How I move.
How
I move.
Today, I want us to learn how things move. People do
Okay.
what?
Walk.
People walk.
Yes.
And that's what I'm expecting from you. That in few days, you're going to walk back to
School.
good. Now, here I go. First animal that I know you'll get interested in.
Yes.
What is that?
A monkey.
A monkey. How does a monkey move?
By swinging.
Can you swing using your hands? Swing. Swing using use your hands to swing. Swing, swing, swing. 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 Good.
Fast.
You want faster?
No.
Okay.
I was saying so that I cannot lose the balance
Don't
then the
worry.
ball.
I'm here for you. Okay?
Okay then.
The first animal was?
A monkey.
The second one is, guess?
A cheetah.
A cheetah. How does a cheetah move?
By running.
How? Show
Fast.
me. Show me. Good. Initially, this boy was not able to do and to coordinate such. But as we went on through various activities, he was able to imitate animals, he was able to imitate the environment around him, and now you can see the way he's coordinating his hands very well, and is able to merge with his way of doing things. Remember, our goal is to get this boy back to school, walking.
The road to physical recovery has been the hardest. The accident left Ferdinand with inability to chew and swallow food. But slowly, with patience and persistence, he has begun to regain skills that so many of us never think twice about.
We are demonstrating how now he's able to feed. Initially, he was using the percutaneous endoscopic gastrostomy tube because he had issues, a problem with his muscles. He couldn't swallow, he couldn't coordinate the chewing muscles, and even swallowing with speech. Now we trained the muscle. We were able to rehabilitate the oral muscles and the neck muscles. And now for the first time he's able to chew and to taste food using his mouth. And just we want to demonstrate how he's been able to achieve that milestone in swallowing and in his ability to feed. Can you take your juice, Ferdinand? You have a little bit of coordination problem, but that one is also good. In occupational therapy, we say you use occupation as a means and occupation as an end. Occupation as a means, you assess the function of the patient, and also as an end, that at the end of it is able to perform that activity, like feeding, is able to perform that activity. Now you can see he's able to suck juice from the bucket through the straw, and he was able also to bite the cake and eat the cake, which means that the muscles, his oral muscles, have been successfully been rehabilitated. He's able to coordinate them, the lips, the teeth, the tongue, and even the throat to be able to swallow. Now his quality of life has improved, and even as you can see that his health has improved, because now he's able to feed just as normal as he used to be before. So it's no longer a challenge even to parents to feeding him through the percutaneous gastrostomy tube, which requires also high nursing skill and high hygiene skill, because it can cause infection. But this one now, he's happy, he's able to feed, and I think we have discharged him as far as swallowing therapy is concerned.
For Ferdinand, every swallow and movement is a triumph. The therapies have become a journey of rebuilding not just his physical abilities, but also his confidence.
Yes, now you can taste food for after how long time? The long time you've been feeding through the tube? 10 months.
Yeah.
How was your food?
I didn't feel even a taste.
Yes.
I didn't even feel any sweetness or any taste.
But now you can feed on, you told me nyama choma?
Yes.
Oh, you can eat nyama choma.
Oh yes, I can.
And which other food? Any food.
Food I can able to eat it.
Very good. Yeah.
Yes, I am.
Yeah.
Because of you and God.
Yes.
You have helped me a lot.
A lot.
Yes.
We thank God for you.
Yes, we thank God for you.
Ferdinand's parents have seen a lot of improvements on their son, and that gives them hope.
Improvement yameimprove sana, because initially hakuwa hata naweza kusimama, mikono yenyewe hata ilikuwa stiff, haikuwa ina move. Shingo yenyewe hata hakuwa inasoft, ilikuwa tu ana move right left. But after therapy tumeendelea vizuri, akakuja mikono akaanza kustretch, miguu pia. Bado kuna therapy nyingine anafanyiwa physiotherapy, but inafanyiwa like twice a week at home. Sasa hapa tunakuja hii occupational therapy hiyo ya viungo. Tulikuwa tunatumia splint, but these days now he's not using splint. Now he can, now he is studying. Now we are looking forward to the day he's starting to work.
His mother encourages other people who have patients with similar conditions about the importance of occupational therapy.
Kwa mashauri yangu kama mzazi, nimesema ya kwanza ni kuwa na uhusiano na Mungu, kuomba Mungu akusaidie kwa hii mambo, sababu si rahisi venye mtu anaweza fikiria, na upendo mwingi kwa ule mgonjwa mtu ako naye, na kufuatilia maagizo ya daktari. Kuna wengine wanaambiwangwa ati enda speech therapy, wengine wanapuuza wakifikiria how will it work. Lakini sisi kulingana na venye tumeendelea na mtoto wetu, kusema ukweli ina work. Hiyo ukiambiwa kama ni speech therapy, fuatilia, sababu mtoto wetu nasikia hakuwa anaongea, tumefuatilia huku na hao madaktari, tulikuwa na Shivashi, tulikuwa na Eric, na wametusaidia sana. Mtoto ameweza kuongea, mtoto kwa sahi hatumii mpira, anakula kwa mdomo yake. So wenye mko nyumbani na mko na wagonjwa kama hawa, ningemuhimiza mutilie maanani ya kuenda hospitali. Fanyeni hiyo therapy, ina work, inafanya kazi.
The journey to recovery is never easy, but it is always worth it. For Ferdinand, learning to swallow, chew and eat again is just the beginning. With every step, he's rediscovering a new part of himself, a new chapter in his story of resilience. This is not just a story of survival. This is a story of triumph, of a young boy overcoming the odds to reclaim his life.
I am feeling good, and I have noticed a lot of progress in my body. Yes.
Like what?
Like talking, eating with my mouth, you see. Like almost a month ago, I used to use a feeding tube, but now I can use my mouth. Yes. And I can use my hands to feed myself. Yes.
Now you can talk.
Yes. I really give thanks to God and my doctors who have helped me a lot.
In Kenya, thousands of families face a quiet crisis, a disease that erases names, faces, and stories. This is Alzheimer's disease, and according to Dr. Magada, Alzheimer's is at times mistaken for dementia. But how do they differ?
Alzheimer's disease is part of a group of diseases that cause what we call dementia. Dementia is defined as a progressive decline in cognitive abilities. When we talk about cognitive abilities, we are saying reduction in ability to learn, loss of memory, altered behavior. And so dementia then encompasses many other diseases apart from Alzheimer's. Alzheimer's is part of what we call primary dementia. Other types include vascular dementias, and it's important that we differentiate, because there are also some dementias that are caused by reversible causes, for example, depression, thyroid disorders can give memory issues. Now, Alzheimer's, in Alzheimer's, there is a part of the brain that controls learning that is usually affected, the hippocampus. It's a part of the brain. So it gets affected, and then you get, the people start declining in their ability to remember things, especially recent memory. They can remember remote memory, the long-term things, things that were done long ago, but they can't remember the immediate things. And that therefore means learning becomes an issue.
Alzheimer's in often cases is mistaken for normal aging. However, it affects over 50,000 Kenyans, mostly those over 60 years, but awareness is low. It is still the past, but love, patience, and understanding can protect the present. Alzheimer's is accompanied by various symptoms.
You get loss of memory, especially recent memory. You'll find that they may not remember where they have kept their phones or their money. You find some bit of change in behavior. And then some become aggressive. They even, you get for people forgetting the names of others or who they are, yet they're part of the family. So mainly it's the issue of memory, but you get impaired learning as well. And also, like I said, change in behavior. And this progresses from early signs, and it keeps going to a situation where now they are not even able to, if they get out of the compound, they will not know how to get back. So they are sort of limited to certain levels.
In Kenyan communities, Alzheimer's is oftenly misunderstood. Some call it madness, others think it's a curse. And the progressive brain disorder sadly not only affects thinking, but it also triggers behavior change which could cause trauma. The question is, what are the risk factors of Alzheimer's?
Age and genetics. It's a progressive disease. And because it's a progressive disease, sometimes there may be very little that can be done. However, there are certain factors that could sort of precipitate it. We've had, from experience, patients who, when they are given certain drugs, for example, sedatives or drugs to alter their behavior, antipsychotics, then the symptoms are triggered. So usually we have to look around nutrition, we have to look around factors that would alter their mood, causing depression. We have to look around drugs that they could be taking. We have to look around the underlying comorbidities, underlying the diseases, for example, diabetes, hypertension. We have to look around all those to make sure they are well taken care of, because they pose a risk in precipitating memory disturbances in a patient who is already genetically predisposed or age-wise predisposed.